My name is Richard Schwartz, and I'm a psychiatrist.
I'm Dr. Jacquie Olds, also a psychiatrist.
I teach at Harvard Medical School and through the McLean Hospital Residency Program. And along with my wife, Jacquie Olds, we have developed a personal light tracker.
It's called the SunSprite. And the SunSprite is a wearable sensor that you can use to make sure that you get the right dose of bright light at the beginning of your day. Bright light has a surprising amount of control over your brain function. So it goes into your eye, hits those receptors in the back of your eye that go right to something called the suprachiasmatic nucleus. And that nucleus is the thing that controls all your hormones, including especially melatonin, which is what controls sleepiness or wakiness. You need a certain amount of bright light first thing in the day. And that kind of bright light has a signaling effect on the brain, which wakes up your brain and allows you to think more clearly.
This is an effect through the eyes, not the skin. You can wear sunscreen and still have this effect. You can be fully clothed. So exposure to sunlight through a window or through your car's windshield is perfectly good. And the idea that circadian rhythms are powerful and that light regulates them is really hard science. It affects your temperature, it affects your alertness, it affects your sleep pattern, it affects how you digest food. It turns out that our whole body has to do with this 24-hour cycle.
There are many, many medical syndromes that can be improved by bright light that we have found as we've investigated much more thoroughly. For example, Parkinson's, postpartum depression, attention deficit disorder. Those are a disparate set of syndromes, and you would not think there was anything that would tie them all together and improve them as simple as bright light. But in fact, bright light makes a big difference. There is the danger that it sounds so natural that people say, oh, they must be counterculture doctors who are going to tell people to drink blue-green algae next. Woo, woo, woo. And we don't want to come across like that, but it turns out that nature part is extremely important, and it's fantastic to have 30 years worth of scientific research proving it.
Bright light, as we're talking about it, is anything brighter than 2500 lux, which is about the brightness of an overcast day. That's the threshold for this effect that has been studied on mood, alertness, awakeness. Our eyes are not very good at judging absolute brightness. So in order to know when something is bright enough to get the effects we're looking for on the brain, you need something to tell you when it's bright enough. SunSprite can help a lot of people to do that. Well, the first thing that SunSprite does is that it lets you know when the light is bright enough. The next thing it does is it lets you know how much light you've accumulated. And the last thing it does is, through the connection to its app, it will give you a graph of when in the day you're getting your light and see whether you're getting it at the best time and help you to sort of fine-tune things if you're feeling not as energetic, alert, as attentive as you want to be.
In the world of psychiatry, where we're trying to help people change, we find that when they keep track of a quantity over time, they're so much more likely to become conscious of it and have it become a habit. So we want to put that back in your health equation so that you don't just get exercise and just care about what you eat, but you care about getting some bright light time.
SunSprite is the first light tracker that is not a complex, expensive research tool. This is the first light tracker that's available to everybody, allowing individuals to have the information, the data they need to be able to attend to their own health better.
Getting people's consciousness up about how much bright light matters. We feel that we could affect far more than our individual practices and maybe have it have a beneficial effect on the whole population.